Good morning, good afternoon. I'm seeing folks join our webinar. I'm going to pause for just another couple seconds, give folks an opportunity to get in. Great. All right. Well, good morning or good afternoon to everyone joining today. I'm Rachel Forensic. I'm a director in the Non-Infectious Disease Department of the CDC Foundation. For those of you that don't know, the CDC Foundation is an independent nonprofit that was created in 1995 by Congress to bring together the public and private sectors and build partnerships that save and improve millions of lives in the US and around the world. Our collaborations with the Centers for Disease Control and Prevention and with private and philanthropic partners help us create greater impact than any of us could do alone. Since 2020, the CDC Foundation has engaged partners in a comprehensive approach that has secured more than $10 billion in public-private commitments in support of the White House's National Strategy on Hunger, Nutrition, and Health. The CDC Foundation is proud to lift up the work of others in this space and to act as a convener to bring together others who understand the fundamental role of food and food systems that plays in promoting health and well-being. Today is the second webinar in an ongoing series that we are hosting to share information, innovations, and facilitate connections between others doing this work. The feedback we received from our March webinar said that people were interested in learning more about SNAP and WIC. So we are here today using a more informal format to learn from leaders in the field, ask questions, and connect with others who are doing this work. If you haven't yet been to our Hunger, Nutrition, and Health website, impacthunger.org, let me say that again, impacthunger.org, please check it out. You can sign up to receive our newsletter and stay informed about other events. I believe that is also going to show up in the chat. So what are we going to be doing for the next hour and a half? I mentioned that this is a more informal format for a webinar. First, we are going to be hearing brief remarks from our esteemed panel, followed by a question and answer segment. Then we're going to actually, we were going to move into breakout sessions to connect, but we're actually going to all stay together and have some conversation to more deeply reflect on the conversation and give you all an opportunity to talk to each other. One last update before we begin is that I wanted to make sure you all know to be on the lookout for a survey that's going to be coming from us, asking about your progress on your commitments. There will be two different surveys. One will go to all those who did have White House commitments, and then there will be a second survey that goes to our entire mailing list to include anyone who wants to report on their work for inclusion in our report. So please be on the lookout for that. Okay, I think I have gone through our introduction, and now I believe Diane is going to put up a Zoom poll asking you all what type of organization do you represent? Community, neighborhood-based or nonprofit, corporation, foundation, philanthropy, academia, health system, payers, trade associations, local government, tribal communities, state government, federal government, or none of the above. Let's give you all just a second, and then Diane will end that poll. I think we're giving you just a couple more seconds to type in your response, to click your response. And I think we can now end the poll. Great. Looks like we have the majority of folks from community, nonprofit, local organizations. Unfortunately, we don't have anyone representing tribal communities or the federal government. So that's something for us to work on next time. Thank you so much for putting that in for responding to us. Okay, now I think I'm ready to close this piece out and hand it over to my colleague Diane Kolak, who is going to just introduce the speakers that we have for our next component of the program.
Thanks, Rachel, and it's wonderful to be with all of you today. My name is Diane Kolak. I'm a program officer with the CDC Foundation, and I'm going to provide some brief introductions for our panelists who we have. We have Dr. Kari Jackson Cotright. She is the Director of Nutrition Security and Health Equity for USDA's Food and Nutrition Service, leading efforts to advance food and nutrition security. She serves as one of the 2 departmental representatives on accelerating action on the White House Conference on Hunger, Nutrition, and Health Goals to end hunger, improve nutrition and physical activity, reduce diet-related diseases and disparities, as well as implementing the corresponding national strategy. Also from USDA, we have Shavana Howard. She is a senior advisor for food, nutrition, and consumer services. Before joining the USDA, Shavana served as the Assistant Secretary of Family Support at the Louisiana Department of Children and Family Services. She's here today to talk about the SNAP program. And last but not least is Whitney Carlson. She is a senior communications manager at the National WIC Association. Whitney works closely with WIC staff and participants across the country to create outreach and marketing resources and connect local WIC offices with the resources at the national level. Great. I am going to turn it back over to Rachel.
Thank you, Diane. Just a reminder to our audience, as you're hearing from speakers, please go ahead and add your any questions you might have into the chat so that we can be monitoring that and be ready for our question and answer period. So first off, thank you so much to our esteemed panelists who are here today. We're very appreciative of your time and the great work you're doing. Dr. Cartwright, it's really nice to have you here today. And I think I'm starting off with you for your brief opening remarks. Can I hand it to you now?
Sure. It's just saying it's unable to start video, so maybe the host can start that for me. Let's try again. Can you hear me?
Yes, we can definitely hear you.
I can hear you.
Oh, you can hear me?
Yes.
We can, yes. Okay,
so let me try again. Okay, let's see if the host can the host start my video for me?
Let me see.
I think Diane is checking that out.
Let's start with, if you don't mind, let's start with Whitney from National WIC Association. We're just having some technical issues with our USDA folks. So we'll sort that out. Whitney, can we put you on the spot to jump in next?
Yeah, absolutely.
Great. Go ahead. Carry it away, Whitney.
Oh, great. Do you want me to share my slides?
If you have any, please feel free to. Yes.
Okay, great. Hi, everyone. My name is Whitney Carlson. I am, as they mentioned, the Senior Communications Manager at the National WIC Association. Let me get my PowerPoint up for you. Today, I'm going to talk about the WIC program and then also the National WIC Association and how we are working together for the White House priorities. Great. So Just to start off with WIC. What is WIC? It is the special supplemental nutrition program for women, infants, and children. It's a federal program through USDA. It's implemented through state and local agencies across the country. WIC aims to safeguard the health of low-income infants, women, and children up to age 5 who are at nutritional risk. So that includes pregnant folks, breastfeeding parents, and then any children up to the age of 5. WIC also provides nutritious foods to supplement diets. We do healthy information on healthy eating, breastfeeding support, referrals to healthcare, and more. WIC is a really great community program that really supports the health of families. And then a few other points about WIC. Currently, there's about 6.7 million mothers, babies, and young children who participate every month. And this year is also, as you notice, the 50th anniversary of WIC. So we've been really excited about celebrating all the good work WIC has done within the last 50 years. Moving on to the National WIC Association. We are the nonprofit voice for all of those WIC agencies who serve those millions of families across the country. We offer education and guidance and support to WIC staff, whether that's in webinar form, conferences, or even like marketing and outreach materials, which is where I come in. We also work with grants and partners to drive innovation and advocacy to strengthen WIC and to modernize the program. As we are working toward a nation of healthier families. Another huge part of what we do is grassroots advocacy. So we lead a group of partners and WIC staff from across the country. We advocate at the local, state, and federal levels to make sure that the decisions that are being made are in the best interest of families in the country. So a little bit about the work we're doing, and specifically related to the National Strategy for Hunger, Nutrition, and Health. A really cool thing about this is that WIC was actually born out of the first conference for Hunger, Nutrition, and Health White House Conference back in the 70s. So it was pretty exciting to be invited to this second one, knowing that our whole program was born out of the first meeting. So taking that into consideration, we do have a lot of pillars that we've been working on and projects that we've been doing to make sure we are upholding that hunger, nutrition, and health for the families in this country. So first off, probably one of the biggest things we've been working on is enhancing WIC participation. So that's doing recruitment and retention work. We have been working to not only like increase enrollment, but also reduce stigma and elevate the awareness of WIC's benefits to kind of use messaging and marketing to not only educate folks about the program, but kind of dispel some of the myths that are out there. We work with a lot of partners to accomplish this. A couple projects we've been working on recently is the 50th anniversary campaign. We've been doing it big this year, working with a lot of folks from across the country on their events, but also just making sure that WIC is in the conversation across the country. Another thing we do is the National Recruitment and Retention Campaign. That is a WIC brand and marketing and outreach materials that we work with WIC agencies and partners on. We also create like toolkits and things like that that folks can use with whether that's WIC staff or partners to kind of, again, educate the general public about the program and encourage folks to sign up if they're eligible. Some work within that retention and recruitment campaign is our community partner engagement. So we have a community partner outreach toolkit to kind of help folks bridge that gap between working with WIC and working with a community partner, how to start that process, how to build those relationships. So I know they will have all these resources for you as well. But that's one is our community outreach toolkit. And then we've been doing a lot of work with healthcare providers in particular. So we have a healthcare provider toolkit. We've got a webpage for folks for a little more information, again, on building those relationships, bridging those gaps, and sharing information with those folks. A big part of what I've been doing personally in the last year with the healthcare provider outreach is going to conferences like AAP and ACOG and a few others, and exhibiting there on behalf of WIC just to inform doctors and educate folks on the program. We've seen a lot of folks get super excited about WIC, a lot of doctors at these conferences, and quite a few misconceptions that I'd never heard of before. So it's good to really get out there and like make these connections and face to face to learn about how we can better provide materials and resources to educate folks on the program, but also how to help doctors connect their patients with the program as well. So part of that, we have a whole toolkit, something that actually just came out yesterday. We worked with a partner to create, it's establishing referral and data sharing processes with healthcare providers. So we did a couple case studies, did some research and figured out some best practices on establishing those relationships, particularly when it comes to data sharing, which is important as we're trying to modernize the program, making sure that healthcare providers and WIC providers and community partners can kind of like talk to each other and share information to make all those referrals easier. Great. Okay, so moving on to facilitating WIC enrollment. This is another huge pillar of ours for the National Strategy for Hunger and Nutrition and Health. One of the biggest projects, well, just to go over WIC enrollment for a moment, one of the biggest reasons folks don't enroll is because of very real and also perceived barriers to the program. So folks tend to think it's like a very difficult process that's really complicated. There's even like physical barriers like transportation and things like that for folks. So there's a lot of reasons why someone might not try to enroll in the program. And we are trying to problem solve those. One of the ways we are doing that is with signupwic.com. This is a website we've had for about 7 or 8 years. For the last, well, since it started, folks could put in their address, find a WIC clinic near them, give them a call and make an appointment. What we redesigned it for is to add more information about the program. So folks can go there not just to find their local clinic, but to also learn more about the benefits in the program, learn how to enroll. We kind of try to walk them through the process so that it doesn't seem so complicated. And then also an assessment tool that kind of helps them gauge if they're eligible or not. And then along with connecting them with their local clinics. Another thing we're doing is if someone lives in a state that has a pre-application form, because some states you can like start the application process online, which is great. Another key thing for helping folks get enrolled easier, making it more accessible. But not every state has that, but with the new website, the states that do, we can just send people directly to that page and they can just get started right away. And that's a really nice new feature. When we were developing this, we got a lot of feedback from WIC staff, but also we have a participant advisory council at NWA, and it's made up of like a dozen WIC participants from across the country. And they really gave us a lot of great feedback. We had some sessions with them about the website, just to make sure that we're getting their lived experiences and their perspectives, because the information that they were looking for or that was really important to them wasn't necessarily what we thought was the most important. So it just really underscores the importance of making sure we have those voices in the room as well. So we work with that participant advisory council on a lot of projects at NWA. Moving on to our other two, I'll just breeze through these, diversifying the WIC workforce. We are working to invest in professional development for WIC staff. especially those from underrepresented communities, and foster more inclusive and effective service delivery system. And kind of tied in with that is cultivating health equity champions. So not only are we trying to diversify the workforce, but also educate the folks in the workforce on equity, diversity, inclusion, and belonging, helping them to be leaders in that area as well. And then a few other, just going over some of the resources we have. The WIC Hub is a great resource for anyone. Pretty much. It has resources for healthcare providers, community partners, researchers, advocates, kind of a little bit of everything. And there's a search tool to make it a little easier to find information. But if you're looking for toolkits, research projects, anything like that, you might be able to find it on the WIC Hub, at least some more information about it. Sign Up WIC as well. Something else with signupwic.com that we're trying to do is we have a resource section that we're building out, and we would like to work with like healthcare providers, the CDC, and some other folks to kind of build out that resource section with information that would be important for families who are looking to sign up for WIC. And then we have a couple of, like I mentioned, the community partner engagement, healthcare provider engagement, a few of those toolkits that I mentioned as well. And then if you are looking to do some innovative work, the WIC Chow grants are happening at the moment. It's round 2. So if you have some ideas and you are looking for some funding and you'd love to work with WIC, deadline September 6th. So make sure you check that out as well. So anyway, that's all I have. Thank you so much for being here with us today. I'm glad we got to talk about it. Thanks.
Thanks, Whitney. Thanks so much. I already have some questions for you, but I'm going to hold them for a moment. And I also thought if, as you were talking about some of the ways you're trying to work to break down barriers, if there's others in the audience that are doing if they're doing things that are innovative to try to break down those barriers for enrollment, please put them in the chat, or let's talk about them in the discussion. So
Yeah,
thank you. Great. Dr. Cartwright, Shavana, thank you so much for being here. Apologies, we couldn't get the video and audio working right away, but so glad you're here. Let me turn it over to you to hear about the USDA and your priorities in this area.
Yes, thank you so much. Thank you, Rachel, Sharon, Diane, for hosting this webinar. And again, we're excited to be here. I am Kari Cartwright. I serve as the Director of Nutrition Security and Health Equity in the Food and Nutrition Service here at USDA. And a big part of my work is really leading a whole of department approach to tackling food and nutrition insecurity. And we started this initiative about 2 years ago under the direction of Secretary Vilsack. And he really wanted to have this as a core priority. So I also serve as one of 2 points of contacts on the White House Domestic Policy Council to help leverage all of the work and the commitments that were developed as a part of the White House Conference on Hunger, Nutrition, and Health. So again, so happy to be a part of this discussion. And I'm hoping that we'll reach those goals to end hunger, improve nutrition and physical activity, and to reduce diet-related diseases and disparities. And I hope one day soon we'll end diet-related diseases and disparities. And so as we really look at the work that I'm doing, is we're building on our long-standing efforts and our commitment to eliminating food insecurity. And so our work, we've done decades-long work of trying to make sure that people across our country are food secure, but we've had this shift toward nutrition security. And so first I want to make sure that you understand the definition for nutrition security. And we have come to define that as everyone in our country having consistent and equitable access to healthy, safe, and affordable food that is optimal for their health and well-being. And so that's a shift. It's an exciting shift. I'm so passionate about it. It excites me every morning. And there are 2 core motivations for changing that is, one, recognizing that structural inequities make it difficult for many people in our country to live a healthy lifestyle. And 2, the pursuit of health equity, meaning that everyone has a just opportunity to be as healthy as possible. So as we think about our work and the Biden-Harris administration's commitment to driving change toward equity, especially racial equity, it is so important to think through policies, programs, and practices. So here at USDA, we have stood up our first Equity Commission, and we had our first Equity Summit. And so all of our departments have equity plans, and we are really working with our key partners and internally to identify ways that we can dismantle racism, because we know that structural racism harms health in ways that can be described, measured, and dismantled. And so as we think about that, we're going to keep continually examining our existing policies. And at the core of our approach for food and nutrition security is our suite of more than 16 nutrition assistance programs. You see Shavonna's lovely banner behind her for our Sunbucks. I'm going to let her talk a little bit about that. But our programs reach 1 in 4 Americans, and we know that we can do more. And we want everyone who is eligible for our programs, millions who are eligible, to be enrolled. And so as we think about the work that we're doing for food and nutrition security, I'm just going to summarize and let you know we scaffold our work in 4 pillars. The first pillar is meaningful nutrition support. So as we think about that, we think about support, nutrition education, resources from pregnancy to birth and beyond. The second is healthy food access. So thinking about that access to healthy, safe, and affordable food that I mentioned in the definition. The third is collaboration. And we really want to enact collaboration through partnership, through working. And we've done so many things. You think about us updating the Thrifty Food Plan and so many wonderful ways to elevate our programs. And last but not least, our last pillar is equitable systems. And we're working on prioritizing equity every step of the way. And I really love to say, you know, we tend to say we're looking at things with an equity lens, but when we have a lens, that's like pulling your readers on and off. I want us to have equity LASIKs. I want us to think about equity right at the beginning so that we're not trying to retrofit it, because it's so important to think about that. And so another one of my wonderful things that I get to do in this role is to work on Secretary Bill Sand's goal of making My Plate a household name. And so I'm so excited about that. We have a national campaign. We've been doing a public tour because we are so excited about working toward the goal of making certain that everybody knows about myplate.gov. You might not know that My Plate is on Instagram now, but we have tons and tons of resources. You can ask Alexa about My Plate, but we want to see My Plate everywhere, where people learn, pray, work, live, play, everything. And we want it to be highly visible in everyday life. And so we know that you can help us to reach consumers. And one of the things that we're doing is making sure that My Plate is contextually, culturally, and linguistically appropriate. And I have some pictures and some resources that we'll share. We have a social media toolkit, but I'll share that with Diane so she can share that with everybody that is on the webinar. But we are just making wonderful strides on those efforts and our efforts to advance food and nutrition security. I know we can do better together. I'm so excited about this discussion. I'm going to pass it over to my colleague, Shavonna, to talk a little bit about her role in SNAP. Thank you.
Thank you, Dr. Cartwright, and thank you so much for having us today. My name is Shavonna Howard. I'm a senior advisor within FNS. And as Dr. Cartwright said, I really primarily focus on the SNAP program. But as you can imagine, as you all know, SNAP is a large program, and there's so many opportunities, but we are really focusing on really supporting states to ensure that individuals truly have access to healthy food options. And so in that work and our support to states, we're really engaging on, I would say, probably 3 core concepts as we work with states to deliver and ensure that individuals can access the benefits that they need. And we're doing things such as enhancing our support to states. It's providing new systems, new tools, updating policy and guidance to ensure that individuals who are eligible for the program can truly access the program. And some of you may have seen that in some of the things that we have done throughout the years since the pandemic on SNAP, things such as, the interview waiver and extending the interview waiver for more households to ensure that people have the option to apply for benefits, but not be turned away if they don't complete the interview. We're looking at improving program access for our WIC program. I think that was discussed a little bit earlier, but we're also working on really increasing our engagement. How can we better support states to ensure that benefits get into the hands of the individuals who truly need them? We're looking at things as, looking at flexibilities within current regulations, within using non-merit staff, and partnering better with local farmers so that we can ensure that we have a smooth transition and opportunities for individuals to truly have healthy food options where they live, even if that is a rural community. And then lastly, we're really focusing on strengthening our internal capacity. It's a lot of work for states to operate these programs, to ensure that people have access to the programs and that they know where to go when they really need some help and some support. and that they're not turned away when they actually get there. So we are leveraging existing processes, bringing on additional tools and training internally so that we can be better partners and better collaborators, like Dr. Cartwright said, to ensure that people who really need these programs have the availability to access to programs, to apply, to get through the interview process, and to truly get the healthy food and nutrition options that they really need. Thank you.
Thank you so much. That was fantastic. I'm going to start off with a few questions. I know that I can see a little bit of activity going on in the chat. We'll pull in some audience questions in a moment. I wanted to ask a question to all three of you, any of you. If you could talk a little bit about what is happening, what are you all doing? Is there any specific work regarding food access security for pregnant women and women of childbearing age? I think we know more and more about how important that is for the mother, and even more so for the developing baby. And I wondered if you could say anything about any work you're doing specifically with that population.
I'll talk. Well, I know Whitney has a lot to say, but I'll talk a little bit about our work with the Dietary Guidelines for Americans. And so, of course, we know that we have our Dietary Guidelines for Americans 2020 to 2025. Right now, our committee is meeting for 2025 to 2030. And last year was the first time that we added 0 to 2-year-olds to the Dietary Guidelines as an age group. So that is wonderful. So you'll see a plethora of resources that are available on our Dietary Guidelines website, and it's broken down by life stage and in multiple languages. And so I want you to take advantage of those resources. When I talk about, again, myplate.gov, we also have resources on there for, again, we talk about pregnancy to birth and beyond for mothers who are of childbearing age, for young children. And we have a MyPlate National Strategic Partnership, and we have partners, 147 partners who are working in that specific age group and area. My actual research background is in early childhood obesity prevention. And as we think about that, there are resources for parents for one of our partners, for example, with the Partnership for a Healthy America. And there's a campaign called Veggies Early and Often. And so those resources are available, but we have tons of things. And I would love for them to get out and be shared because our team works so hard on them. And we want those resources to come to life for our consumers and participants.
Yeah, that demographic. Oh, I'm so sorry. Shivana, you go ahead.
I was just going to add very quickly. I think one of the other things that you'll see, and you can access information on the USDA FNS website, is there's several grant opportunities that have been made available. I think Whitney mentioned the child grants earlier, but there's other in the WIC modernization space as well as the SNAP space. And I've had the opportunity to visit several states who've taken advantage of a lot of these grants, who are being very innovative and using those grants to truly collaborate and create one-stop shop for individuals as they're accessing our programs. So you can go to a health clinic and actually receive WIC services, but also speak with your doctor who says that, you need healthier food options, who is actually prescribing you SNAP. And in that same conversation and in that same office, I was able to witness a mom who had just given birth. The child was, I want to say, like 4 weeks old, who actually was able to connect immediately while they were waiting for the doctor to actually have an application for WIC, followed by an application for SNAP benefits. So I think there's just so many grant opportunities that have been made over the last several years through the administration to really create those type of opportunities so that individuals don't have to go all around the world just so that they can really access those needed resources and supports. And there's grants that are currently available, and we can definitely provide some links or some information to Rachel or Diana so that you all can be aware of some of those opportunities so that you can tap into some of those resources and support.
And Whitney, let me just, I'll be remiss if I didn't mention, we have a Start Simple with MyPlate app, and it is so wonderful. You get to take a MyPlate quiz and you get to plan out your meals and so many wonderful resources to make a healthy and balanced plate. So that's another resource for all of our consumers, but even specifically for those who are raising young children or of childbearing age.
Yeah, they mentioned the dietary guidelines. So the WIC food package just got updated in April of this year. So that's very exciting news. I know they have some even better things for like pregnant women and breastfeeding folks. WIC in particular, I mean, like that's one of our main demographics is pregnant and breastfeeding parents. Talking about like myths and things like that, or connecting folks with, what am I trying to say? I'm so sorry, guys. I think I'm a little sick today, so my brain is a little foggy. It's just not working great. But for reaching those pregnant folks, a lot of misconceptions out there, like they think they're not eligible until the third trimester or things like that. So we've been working to do better messaging to connect with those folks and let them know like there are so many resources available. They just need to know about them. So working with community partners and healthcare providers on like educating them on what's available out there, I think is super duper important.
Thank you, Whitney. I know there's a question for you, Whitney, but I did want to follow back up. Shavana, you mentioned WIC and SNAP. There was a question about, is it correct that families can be on both WIC and SNAP?
Yes, absolutely.
Absolutely.
And we are actually we have been working at the federal level with the Department of Health and Human Services to really help streamline the WIC enrollment process through state level referrals. In 2023, we issued a policy to state agencies really on how they can reduce the burden on SNAP and WIC eligibility that we are hoping will see some results and some increase. Prior to this position, I was the Assistant Secretary in the state of Louisiana, and we worked very closely with Health and Human Services in Louisiana as individuals were applying for SNAP, and they appear to have met the the minimum requirements to do a very warm handoff of really just a transfer to the WIC line, make sure they're aware of WIC eligibility and their local offices. And I think that's happening throughout the country, and I'm hopeful that we'll continue to see that moving forward. But we definitely do want to get the word out, and definitely that people who are on SNAP are still eligible for WIC. You can receive both programs at the same time.
Thank you for that clarification. I was able, in a quick minute, I was able to follow myplate.gov. So I'm looking forward to seeing what comes out there. Was having a wish for a moment that we could have had myplate.gov sponsor the Olympics, or be a sponsor and have it, right? Everybody is probably,
what an amazing idea, Rachel.
I know it takes a little bit of money, right? But aren't we all looking at things on TV, on Instagram, watching that, and what a great place. I'd love to get those kind of messages, and not necessarily what, I don't know what credit card I can use.
Exactly.
Let me turn it to Diane. Diane, do you have any questions for our panel that you'd like to, from the audience, that you'd like to share?
Yes, we've been getting some really good questions in the chat, and I'm going to throw the next one over to Whitney. We have a question from Dion, and they would like to know, how does WIC work with local urban farms?
A really good question. I think it mostly depends on like your local and state agencies. But WIC has a really great farmers market program that I'll touch on. It's not every state has a farmers market program, but the ones that do, I think the majority do. And WIC participants can use their benefits at farmers markets with local farmers for local produce. And so that's like a very exciting project, part of the program. And we're working on a project right now to help folks like spend their money or spend their benefits at the farmers markets. So like, how can we increase that accessibility? How can we make it easier for folks to do that? So that's, I would say, like the biggest way that they work with farmers and urban farms. But I also know that there are some, depending on the local agency, there are some that have like their own little gardens in the back of their WIC clinic. We just did a trip to Hawaii for like a site visit, and they had like a little medicinal herb garden behind their clinic for like anything you would need for breastfeeding or whatever. It was like a very local and community centered thing. So I think there's so many options, endless options for WIC agencies to get involved with like local farms, but on a bigger level, farmers market nutrition program would probably be the best way.
And there's a follow-up question, is DC included in the WIC Farmers Market program?
Yes, DC is. When I go to the farmer's market, on the weekends, they have little signs on some of the stalls. So if a farmer participates, they will have a sign that says like, we accept WIC benefits, SNAP benefits, things like that.
Wonderful.
Rachel, can I jump in with a question for our friends from USDA? Okay.
Please do.
Great. So as I said, we've been getting some really good questions in the chat, and audience, please keep putting those in because we want to hear from you. Karia and Shavana, we have a question about food specifically. Is there a way that people can order food for families, or is there a tool to see if families are qualified? And there's a similar question that we have. So I'm going to lump all three together. The third is, are there any delivery options through your programs?
Well, I know Shavana probably can add a little bit more, but I do know that I'm so excited that we are able to have SNAP delivery in all 50 states. And that took a long time to get SNAP online. And so that's a wonderful thing. I do think with SNAPs, we are working on that option with WIC. Correct me if I'm wrong, Shavana. But so it's a game changer for families in order to be able to go on and have online delivery with SNAP. And then what the first question was about, I'm sorry, ask that first question again. Can meals be delivered to families, I think. And so of course, if you're using the SNAP online option, and I'm just giving an example through Instacart, people can go on and use their SNAP benefits. So in that way they can, but then, there are different types of restrictions in terms of what you can buy. So we're still not doing the hot food, but you can get food delivered in terms of using the online for SNAP, and we're building our WIC platform or working on that as well, currently. So I'll pass it over to Shavana to add anything for that.
I would just add to that, the modernization to SNAP online purchase started prior to the pandemic. I think because of the pandemic, it definitely brought all the states on board and territories, as Dr. Cartwright said earlier. And we do see an increase in the number of grocery stores that are allowing for SNAP online purchasing. There is additional information about the stores that are accepting SNAP online purchasing on our website. I don't know if I can drop it into a chat, but if I can, I will try to do that in between our speaking. But there is definitely a lot of opportunities thank you for that. There's definitely a lot of opportunities that didn't exist previously. A lot of times in the SNAP space, I often heard from rural communities, especially while I was living in Louisiana, on those who are not able to access a grocery store with healthy food options. And there are a lot of vendors who are ensuring that, healthy food options are delivered quickly, like within a certain period of time or window even, so that everyone equally has those same opportunities in the foods that they're able to purchase. And so we are moving, like Dr. Cartwright said, for the same and modernizing WIC, where that purchase can be made online as well. I will say the one thing that I don't know that we've actually solved the problem of is that, SNAP still cannot be used for the delivery fees, if there are delivery fees that are charged for those individuals who decide to purchase food online.
Mm-hmm. And if you go to the website, I saw a question about how do I know if I'm qualified, if I'm eligible. There's a banner right there when you go on the website. It says, let me see what it says. I think it says, how do I know I'm eligible or something like that. It says, am I eligible? And you can click on that. And then there's frequently asked questions as well.
And then I would just add, I know we're going to jump to another one. In addition to the website, as far as who is eligible for SNAP, a lot of our local community partners are great advocates in this space, and they actually do the application assistance. So it's not just being able to go in to see if you're eligible, but they will actually help you complete the application, understand the verifications that are needed from the state agency, and even be part of the interview process with you should an interview be needed as individuals are applying for SNAP benefits, which could be helpful to help people feel more comfortable and more relaxed as actually going through the interview process, which can be intimidating for some.
Mm-hmm.
Diane, what else do you have for our panel?
I have a great question that came in through the Q&A. Speaking of the Olympics and sports, are there opportunities to promote WIC, SNAP, and the SUN programs at local parks and or recreation areas? And that question's from Karen.
Oh, thank you for that question, Karen. I'll start in just saying, we are keen on partnership. And so, you know, I grew up in Atlanta and I grew up in Southwest Atlanta, and I was out of the office. I had to do some things in terms of moving, but my colleague, Sakina Shabazz, came down to our Southeastern region, and we actually were at a recreational center in the neighborhood where I grew up in Adamsville. And we were celebrating the Sunbucks program. The kids were getting produce. And again, I grew up here, so I would have loved to have been there, but of course we have other people who can go and do these wonderful things. So our leadership was there. And so we are constantly working on partnering and showing up in communities and making sure that we are promoting it. And I have to give the entire team, we had a celebration yesterday of all of the programs that really made Sunbucks come to life, because it was fast and furious. But just so excited about those opportunities. So I wish we could be at the Olympics, but we've been at many, many places that you might not have seen. And I'll let Shavonna add any points to that.
Yes, and there's
As well.
more places that we are still going, I will say. It is not over yet. We have a lot of materials that we can use, that we are helping to promote. We will definitely be happy to share, and we're trying to get them out to the public as much as possible. And I can't tell you how much it warms my heart when I go into a grocery store and I actually see an advertisement for Sunbucks in all of our programs, quite honestly, so that people recognize that, you know, one, that the program is alive and well in your community, and this is where you can access and use those benefits at. So happy to share many of the materials that we have if it would be helpful, and we're doing more to get that information out. But if there's more we can do, please also let us know, because our comms team is constantly working to figure out, you know, how can we ensure that households understand what is available to them, what they have access to, and where they can go to get it.
Rachel,
We will definitely be following up to make sure we can have as many of these resources highlighted on our impacthunger.org website. Diane, I'm sorry I interrupted.
Oh, you're fine. I'm glad you said that. I put that in the chat as well. We will post all of the resources. Another question, which I think is great, and this can be for any of our panelists who want to take it. Is it possible to use SNAP or WIC to pay for items such as paper, toilet paper, soap, other necessities that are not food? And that question comes from Adrian, and they add that they see that as a really big issue with the families that their organization serves, and they note that even $100 for those kind of non-food essentials would help.
Unfortunately not. I wish I could say better things in this space, but unfortunately, currently SNAP can only be used for food items, and there is a list on our website. More than happy to drop that link as well on the items that you can use to purchase with your SNAP benefits, but it's not non-prepared hot food items, you know, or alcohol that can be used for SNAP purchases.
Yeah, similarly for WIC, it doesn't cover like diapers or toilet paper or anything like that. But a lot of local agencies have like a little care closet for their participants. Another reason why like local community partnerships are super important, because I know a lot of WIC agencies work with local groups to like provide those types of products for the families who really need it. So yeah, partnerships there, I think, is the key.
That's great. Good to know, and always areas that we can look for, look forward to advocating for, because toilet paper and diapers are really important. Okay, a question we have from Natalie is, she says, we have learned through our work with 1000 Days that pregnant people seek nutrition information from their healthcare providers rather than going to the government website. Are healthcare providers being targeted through the My Plate national campaign? Who and what groups are being reached through that campaign?
Wonderful question. Thank you so much, Natalie. So I'm so happy to say that not only are we doing our work with our My Plate National campaign, we are working on a national effort to improve the intersection between nutrition and healthcare. And so a big part of my work, I'm sure you probably heard a lot about the food as medicine movement, is going out and engaging externally with folks from the healthcare sector, because what we found was that a lot of healthcare providers didn't know about our programs. And so how can they do a warm handoff if they don't know about our programs? And so what started was right after the White House Conference on Hunger, Nutrition, and Health, we had our first National Nutrition and Healthcare Summit. The secretary spoke, and we had tons of leadership, government officials, and representatives from healthcare sector. Since that time, we have had 7 regional summits in partnership, which was led by the Root Cause Coalition and ProMedica. So we're getting that information back, and we're going to hold a second summit to talk about the outcomes and continue to have that work to develop and burgeon. And so we partner with them often, working through nutrition security, partnering on panels and getting the word out about our program so they can learn more about it. You asked about who was being targeted for our My Plate campaign, and it is everybody everywhere. We are making sure that everyone knows about My Plate. I want it to be like the Nike swoosh. I want everybody to be able to recognize it and go and use those resources. But that's a big part of why we are out doing this promotional tour. So I'm in communities. We're doing town halls. We are talking to dietitians. I just talked to nutrition educators at the Society for Nutrition Education and Behavior, but we're also holding regional town halls in each one of our 7 regions at USDA to make sure we are gaining the community's voice about successes, challenges, and recommendations on ways we can do better together on the effort to make sure that My Plate is culturally, linguistically, and contextually appropriate.
And I would just add, one of the beautiful things that has come out of these conversations that have been happening for the last couple of years is a recognition of all of the resources and support that USDA has to offer when it comes to SNAP and WIC and, you know, the My Plate, just all of the programs that follow within our wheelhouse. And the understanding of the grants that have been made available, especially during the pandemic through this administration, and the healthcare industry recognizing that for sustainability purposes, for those grants that are working, they now have a way in which they can continue to support their local communities. So for that WIC office, who was co-located within a health facility and also had SNAP and all the other public service benefits brought to a client in a no wrong door approach, you know, the healthcare industry is looking to actually make that more sustainable by actually paying into that as part of their ongoing commitment to building a healthier community. And so it's been great to see that. I've seen that in several states, and I'm really hopeful that that will continue on, recognizing that we know that short-term funding is just that, 5 years might be great, but it's long enough that we can show outcomes, that we can show that it's working, and that we can truly show the impact that it's having on the local community, as well on, the health and the nutrition of individuals accessing the program.
This is wonderful. It's exciting to see all the different things you all are doing. I can't keep them all in my head. So we will definitely make sure that we get this out to folks. If we did not get to everyone's questions that were for the panelists, we'll make sure we follow up and get those questions answered and get that back to those participating today. Ladies, I have one last parting question if you are game. And that is, do you have anything you can leave us with today? A resource you'd recommend to our audience? Something or someone that you feel like if we all read, listened to, would transform our work or even just make us better human beings? So a little off the, a little separate from all the resources you've been giving, but anything that you feel like you really want to let this group know, just to, again, provide more hope and more alternative ways of looking at things. Anyone interested in answering that?
Sure. I'll jump in and say, before I had my sun banner up, I had a WIC celebration of 50 years up, and I had that up for almost 3 or 4 months. Huge celebration in the WIC space, but still so many more individuals who still are not accessing the program. So we have videos. I'll be happy to provide in the links that I already have prepared for you all if you'd like, that really goes to show what WIC has done, how it has transformed the lives of so many mothers and children and families. And really just want to make sure that individuals are aware of what the program is, how to access the program. And then I'd be remiss if I didn't say, a huge celebration for Sunbucks. Summer months, we know food insecurity is very high. We know that children get a lot of their healthy meals during the school year. Great program that's just starting this year. We'll be sending a lot of information out so you can share that information as well. But we just have to do as much as we can. We have to do better for our children so that they can have those opportunities as they continue to mature and grow.
And I'll say we have several videos. We're working on one around healthcare. We have a nutrition security video. I put that link in the chat. The myplate.gov resources. We have a MyPlate kitchen with a ton of recipes. I encourage you to go and check those out. That MyPlate app is so important. And so as we are doing this work to really learn what nutrition security is, and it is core to our mission. And so if we think about if we're able to achieve that actual definition of what nutrition security is, we'd be a better place. The world would be a better place. So I'm excited with that. I'll leave with you. I'm reading the Bible in 52 weeks, which makes me excited. But for anybody that wants to just make themselves excited, Atomic Habits. I have read it before and I started reading it again, and you can get it on Audible. There's a workbook. It has really helped me to think about perspectives and developing new habits. And for the work that we're doing, we have so much to do. We have to establish those wonderful habits. So those are the things. And I will also leave you with my email. I'm so happy to receive messages from you, and we will be very happy to share resources. So thank you so much for your time.
Dr. Cartwright, we're always happy to have you down in Atlanta. So bring you home. Whitney, anything you'd like to leave us with?
Yeah, it's a great question. I think I'd like people to take away, I'd love for you to visit signupwic.com. And if you would like to, or if you have thoughts on like the resource section, as we're building that out, would love to hear from you on like ways you can be involved in that. But I think, like Shavana said, the 50th anniversary is kind of where it's at for us this year. It's such a great program and we've done so much good work, but there's so much more to do, as always, with modernization. As she mentioned, like about half of people who are eligible are actually on the program. So really working to make sure that we can reach those other families who need these services. I've been trying to think of something like inspirational to share, but I don't really have anything at the moment. But I do really believe we are doing amazing work with SNAP, with WIC, with MyPlate. I think is so great. So yeah, I'm just happy to be here.
Thank you. Really, you all are doing great work. So much is coming out from WIC, from USDA, from across the federal government. So it's really exciting. We're going to make sure we get as many of these resources. I've seen them pop up in the chat. We grab them and we make sure that folks get those resources, whether they could be on this webinar or not. We're not done. We also know that our panelists may have other obligations, so we want to really thank you so much for being here. You are welcome to stay with us, but we also understand that you may have other obligations. I want to also turn to, I'm hoping that she has joined us, and that would be Jennifer Reaney, who is Communications Director of the Delaware Lieutenant Governor's Office, to talk about an innovation between USDA and Delaware. And I can't see the full list of attendees, but if Jennifer's here, can she jump off mute, or can we unmute her?
Sure. Hi, Rachel. This is
Hi.
Jen.
Hi, Jen. Thank you.
See and hear me okay?
Yes, perfect.
Awesome.
Take it away.
Thank you so much. And I really just want to express my gratitude to the CDC Foundation for inviting me to share a little bit about our program. So hello to everyone from Delaware. I'm excited to share about this new program that we announced in July, but has been in the works for quite some time, thanks to all of the wonderful partners that you've heard from, and I'm sure we'll partner with in the future. So excuse me for being a little bit cheesy, but in Delaware, we like to be first, true to our name. So we were excited in July to announce that we are the first state to pilot an innovative app to really help folks stretch SNAP dollars further and feed their families. And what's really cool about this program is it is a public-private partnership in action, and it really addresses food insecurity and food waste at the same time. So we're pretty excited that we're going to be able to take a really deep dive into this issue and help impact families across the state. So for a little bit of background, this program is broadly known as the Smart Food Program. Like I mentioned, it's a public-private partnership that was born out of the White House Challenge to End Hunger and Build Healthy Communities, with the leadership of Lieutenant Governor Bethany Hall-Long, our state agriculture and health agency leads, our federal officials at the White House, USDA, and of course our private partner, R4 Technologies, a new AI company created by the founders of Priceline. So it's been really exciting to see all these pieces come together. And we were able to launch using ARPA funding, and the hope is to see this program scale nationwide. And the goal is to have the 50th state, Hawaii, pursue an iteration of this initiative next. So we're pretty excited to see it kind of take off. So kind of just for a little bit of the why of the program, like I mentioned, this is addressing food insecurity and food waste, but it really comes down to the belief that every person deserves access to healthy, nutritious food. You know, we know it's not only just beneficial to families, food equity, as we've heard, is so beneficial to the economy and our environment as well. So with this program, we're really hoping that we can lower food waste, while we're connecting folks to healthy food at the grocery store. So food is going into someone's pantry and not the landfill. So Rachel, I can kind of talk a little bit about the logistics. I'm a communications professional, so I'm kind of going to go into a broad-based kind of look at this. But kind of for some of the logistics of it, a key component of this program is the SNAP Smart Shopper app. So the idea with this app is SNAP recipients can download the app and have access to digital coupons for specific SNAP approved food. And the goal is to help provide SNAP benefit dollars go further through shopping recommendations and educational resources. So it's a pretty cool model. So it's really similar to the Priceline airline industry model, where retailers and producers will make SNAP approved items available at a discount in specific stores where there is surplus inventories and unfilled SNAP demand, where that's predicted. So like I mentioned, another important element to this is kind of the integration of educational content to help support healthy choices, from meal planning to buying food. So it's a really cool concept. And another important piece to this is the app uses AI to tailor kind of shopping habits, and it really will kind of be a game changer to address all of these issues. So just to highlight again, this was a really exciting way that we can really think out of the box, modernizing the SNAP program, looking at how we can address these, big picture issues that I know everyone on this call lives every day with, the communities that you work with. So we're excited here in Delaware to be able to, try our hand at really addressing this issue. And just want to give a big shout out to our partners, the CDC Foundation, our White House colleagues who really have been instrumental in this and helping, as well as our state partners at the State Health Department and agricultural level. They have been really just tireless in working to push this forward. And I know from the leadership on the Lieutenant Governor's end, this has been a passion project of hers, and just has been really excited to see this kind of move forward. As a nurse, this is just something that is just so important to her. So that was a very quick overview, Rachel, but happy to answer any questions.
Awesome, Jen, that's fantastic. At the CDC Foundation, we like the concept of multi-solving, which is something that this seems to fit right into. One solution that impacts multiple problems or challenges. You've got the impact on the environment and reducing food waste. You have food access, and of course, equity issues that are really important to this. So thank you so much for all of that. Okay. I don't think I see any. Don't see any questions at this moment yet, Jen. but that doesn't mean some won't come in. Why don't we, I think we probably have some of our panelists may have left. Let's move on to our second poll and hope we keep you all around for a little bit longer for some discussion. Diane, do you mind pulling up our second poll?
Just a sec.
And Jen has put her email in the chat if anyone would like to reach out and get more information. Okay, please tell us what would help accelerate your work. What would be most helpful? You can select more of these. Funding to work across sectors, access to specialized resources, capacity building and technical assistance, expanded network of partners and stakeholders, transformative policy change, building public-private partnerships. Give you all just a second to answer that. Got about half of you having answered so far. Not surprisingly, funding is a big one. I think we can share the results now. I think you've done that. Thank you. More funding to work across sectors, as well as expanded network of partners and public-private partnerships. So, partnerships, collaboration is definitely where it's at. Thanks, Diane, for putting that up. And now we want to move into to our more open discussion. We are going to, I think, allow everybody's screen to be seen. And this is an opportunity for us to just have some open open conversation. It could be some additional questions that might have come up for you all. Well, we can ask you all a couple questions as well. What we wanted to ask is if you have a question or a comment you'd like to make, can you raise your hand and we can take you off mute? One of the questions I had asked earlier is, are folks doing, what are folks doing to help break down barriers in your state or local community to increase uptake and sign up for WIC and SNAP? Anything that you all feel like you'd want to share with the group? Let me also ask, are there places, your communities, states or communities where you're concerned that people are not fully participating in SNAP or WIC?
And you can just raise your hand and then we can unmute you to answer and join in the conversation.
And Diane, I'll count on you to just call on folks and unmute them.
Adrian asked if you could repeat that question, Rachel.
Oh, sure. Are there any states or communities that you're concerned are not fully participating in SNAP or WIC? So like the sort of the opposite of, what are you doing that is helping to break down participation in WIC or SNAP? Or are there places that you really feel they're really not fully participating in SNAP or WIC, and you might want some additional ideas or support.
Okay, I have a raised hand from Jaren Hill, so I'm going to unmute you. Go ahead, Jaren. Can you share your thoughts with us, Jaren? Oh, we might have lost Jaren. I'm going to unmute Adrian. Adrian?
Hey, I'm here. Hi, how are you doing? Sorry, I was talking to somebody because I missed the question. But I think to answer your question, because we're Step Up for Mental Health for in Chicago. We have a small helpline, and we feed families who call us and say that they haven't eaten, or they're about to not have food or run out of food. So I'm really happy that I was on the call for the WIC program. The only issue is a lot of people got cut off of SNAP. You know, that's been going on for like a year and a half. And so, and also even food pantries, it's been a big issue for families because the lines have been extremely long for families. And sometimes people, when they get to the front of the line, the food's all gone. So that is a big new reality that's been happening, particularly in Chicago. And so what do we do when we're trying to so we do a bag of groceries we drop off. We have partnerships with organizations like Walmart, Aldi's, and then we drop off a bag of groceries. Sometimes we buy boxes of food that gets delivered, but there's still people who are still don't have enough food. So these are the things that the challenges that we have as a tiny nonprofit.
Thanks.
Thank you. Yeah, go ahead, Dan. I'm sorry.
Well, that's okay. Thanks. I just wanted to say thanks to Adrian for sharing their comment.
Yeah, is there anybody willing to jump in and provide any guidance, support, ideas, anything you've seen work?
Hello, can y'all hear me?
Yes.
Hi, I'm Jaren Hill Lockridge, based out of Washington, D.C. And y'all hear my children in the background, so please excuse, I'm a mom at the time. I love that. One of the challenges that we're finding is people aren't really taking advantage of the SNAP WIC matching that we're doing. So there are a lot of different opportunities for people to maximize their benefits, but we're finding that people aren't aware of that particular benefit, and we're having a hard time. Well, not a hard time, but we could definitely use some support, letting more people know about, you know, the matching part of those benefits to maximize their access to food.
That's a good idea. Thanks. I didn't know that if you had SNAP, you can get on WIC too. That's good. Okay.
So there definitely is an awareness piece.
Definitely. I mean, I think people are used to kind of the traditional benefits, or, you know, there's some traditional benefits that have been that our communities have had access to for a long time. But some of these newer benefits, particularly like even the Sunbucks, right? There's an awareness of letting folks know how and what it means to utilize them. And in DC, we're about to put forth a concerted effort, because I think that the Sunbucks have to be used by like the end of August, right? And don't have to be used by the end of August. And so to make sure that people are utilizing all of their benefits before the time runs out.
Funbucks. I never heard of Funbucks. Funbucks.
Sun, S-U-N.
Oh yeah, it was Sunbucks. I'm sorry, not Funbucks.
That's okay. No, that's okay. S and F sound very similar. I am curious if some of the videos that our USDA colleagues mentioned that they have there, if there might be some videos that help explain what some of these programs are for families that you know, I know I'm not saying it's easy to get things like that promoted in a community, but if it is a resource that already exists that you know, you don't have to develop, I'm just wondering if there could be ways to let, you know, where all the places, you know, families are going, non-traditional places, they're showing up that online, in person, where they could also see that.
Are those videos like social media friendly, or are they like YouTube videos?
We're going to check them out. I have not seen them myself, so we're going to check them out, and I think we're going to find a we're going to put that information on our website.
Okay. Yeah, I think if those videos are social media friendly, easily taggable, repostable, shareable, particularly like in the next 30 days for some of
Yeah.
the summer stuff, back to school
Yeah.
moment. But then also making sure that they are reflective of the community, whatever community you're talking about, right? So if it's in DC, folks that live, look, and sound like DC. If it's LA, you know, folks who look like, sound like LA. You know, that's another key piece, because I think that sometimes these national initiatives, they look very American, and the communities that we're trying to serve don't look like the traditional American. And I'm gonna stop.
No, very, very important comment, Jaren. Thank you. Well, we'll look and see what if they are social media friendly, able to be put there or not. And if there aren't, if that doesn't exist, what a great opportunity to figure out how can those who can help make those happen. If not immediately, probably not by the end of August. For Sunbucks, definitely making sure that there's something ready for next year. I have to imagine that there's other organizations in other states that might have some resources too. Again, like you said, they might not all be appropriate for your region, but some may be. And Whitney says they're also working on some short videos about WIC. So to please feel free to reach out to her. Okay, it's anything else? Any other questions, Diane? We should go to Zoom poll number 3. Who would you like to partner with but are currently not? And you may suggest select more than one. While you're answering that, I just want to remind folks that there is going to be a brief survey that pops up on your screen after this webinar, and we would love to have your feedback. We designed this webinar to be the format it is because of remarks and comments we got after the first webinar, and we want to be able to make those kind of adjustments. So please tell us what worked, what didn't work, what you want to see more of or less of, and we'd really like to take those into consideration as we do more of these into the future. Was it too long? Was it not long enough? All that kind of stuff. We want to know. We definitely want to know what type of other topics that you might like to see in the future. And we also want to remind you to please go to impacthunger.org to sign up for the newsletter. We have, I guess we've stopped I think we've stopped the last poll of who you'd like to partner with. Looks like foundations, philanthropy, national nonprofit, people with lived experience, tribal communities. This is great. Thank you for this feedback. Great. Well, I'm realizing we are coming up on the last of this. I am so appreciative for everyone who has stayed this long. Thank you so much. Again, please give us your feedback. We welcome it. Sign up for our newsletter. We'll be having more coming out. Please don't forget that we'll also be sending a survey about the commitments and whether you've made a commitment to the White House or not. There's a survey for you that we'd really like you to fill out. Would love to, again, I also want to take a minute to thank our USDA and WIC partners for being on this call today, providing such great resources and just willingness to answer those questions, all the questions that you asked. So thank you so much. Again, please, tell us what you want to see more of, less of, and we're going to work that into future webinars we have. So we're so thankful for all of you joining us today. Thank you again, and please look out for another, our next webinar, probably in the next quarter. Thank you so much, everyone. Hope you have a great afternoon. Happy summer. Everyone take care. Thank you.